Hi everyone, this is Dr. Sheila, and I wanted to talk to you about bone health today. So I'm a naturopathic doctor here in Toronto, and bone health is something that it actually does come up frequently, and it almost always comes up in relation to kind of women who are going through menopause. I think that kind of as a society, people have been trained to only worry about it kind of at a certain age. And that's one of those things that it's completely understandable, but it also, bone health is something that is impacted throughout your whole life. So kind of waiting until you're 50 is not always the best approach. And again, I completely understand that that's just kind of the way we do things. So first let's talk about bones. So obviously their function is to kind of keep us upright and mobile. And then they also are protective. So if you think about the way in which your ribs protect your heart and your lungs. But they're also have some pretty neat uses in other systems in the body. So your bones are a huge storage capacity for minerals. So the calcium that we use calcium throughout the body, but if we don't have enough of it from our diet, then we'll pull from our bones. So it's kind of like this big storage unit of minerals that we can have access to if we need. And then lastly, your bones house your bone marrow, and your bone marrow is what creates your entire blood supply, from everything from red blood cells to white. So your immune system, your blood supply, everything is implicated in the bone marrow. So your bones do a lot for us, which you probably already knew. So let's move on to talk about some bone disorders. And the number one, you've probably guessed it, is osteoporosis. And osteoporosis is a decrease in bone density, which leads to weakness of the bones, and therefore your fracture risk goes up. So that's always what we're worried about with osteoporosis is fracture risk. And often people won't even know, sorry, that's my cat. Often people won't even know that they have osteoporosis until they have a bone fracture. So sometimes a hip, a wrist. So the people who are at risk for osteoporosis are people who are small and thin, women, specifically white and Asian races, people with a family history. They're also at risk. This does have a genetic kind of component to it. And then women in general. So there seems to be this link between kind of what happens hormonally at menopause with osteoporosis. So estrogen we find to be protective. It kind of maintains bone health for us. And so when estrogen kind of drops off, we see some shifts in terms of bone health. And I think that's why it's talked about kind of in relation to each other, menopause and osteoporosis. There are some medications that increase your risk for osteoporosis. So there's lots of kind of things to consider. And we'll talk about, a little bit later on in this talk, we'll talk about what you can do for supplements and kind of lifestyle. So the second condition I want to talk about is arthritis, which is really two conditions, because I want to talk about kind of osteoarthritis and then rheumatoid arthritis. They're very different. Rheumatoid arthritis is an autoimmune condition where your body kind of attacks itself. Widespread inflammation affects lots of the small joints in your body. How it relates to bones is it does have a detrimental impact on bones as well. Whereas osteoarthritis is the wear and tear arthritis that pretty much everyone gets some degree of arthritis as they age. So osteoarthritis is the breakdown of the cartilage in your joints, and it just degenerates. And then in severe cases, it degenerates so far that it's no longer there. And then you can kind of get bone on bone, and then you can kind of get some destruction as you can just imagine. I'm sorry for that image. And then one other kind of bone fact in terms of osteoarthritis is that our body can also create something called a bone spur or an osteophyte in kind of a reaction to the inflammation in the joint. Our body will try to protect us, and then it will create this bone spur that actually just makes things worse. So arthritis is really common. That's why I just wanted to kind of put it in the same conversation as bone health, as it does have an impact on your bones as well. The last two that I'll mention very, very briefly is bone cancer. Bone cancer is not very common. It only makes up about 1% of the cancers out there. And then lastly, there's a genetic condition called osteogenesis imperfecta, which also impacts your bones and can weaken them. And that's just kind of a genetic condition that you would be born with. So those are kind of the disorders that we think of when we think of bone health. I want to mention, before I start talking about supplements, I just want to mention kind of what you can do other than healthy eating. And it's pretty simple, doesn't mean it's easy. So kind of an active lifestyle, any sort of exercise works. There used to be a lot of emphasis put on weight-bearing exercise, but now we're happy with kind of all exercise helps in its own way. And then kind of not drinking to excess and not smoking. Those are two things that, again, it's fairly obvious, but they've both been implicated in kind of decreasing bone density. So now I'm going to shift gears and let's talk about supplements a little bit. And you probably know the most common supplement when we talk about bone health, and it's calcium. Calcium is a really important, it's the most prevalent mineral in your bones. It has been shown to help in cases of osteoporosis. So it is one of our go-to supplements. You can get it from your diet in a multitude of ways. It doesn't have to be dairy. You can get it from kind of leafy greens and whole grains, soy, nuts and seeds, sardines, so many different ways that you can get calcium from your diet. And then we do find that kind of as you get older and you're at increased risk, it is not a bad idea to supplement with a little bit more. If you are supplementing with calcium, I really hope that you're also taking vitamin D, which is the next supplement kind of on my hit list here. Vitamin D is on all of my hit lists. It's kind of, if you live in Canada, you are probably deficient in vitamin D. We just don't get that much sun, or we don't get enough sun in order to have adequate or even optimal levels of vitamin D. And then it's also been implicated across the board. You name the disease process, vitamin D has been shown to help. So autoimmune, stress, PMS, thyroid, just vitamin D is amazingly helpful. So pretty much every single one of my patients gets tested for vitamin D, and then we dose it correctly for them, and then we'll retest to make sure that they're okay. Vitamin D is really important because it helps you absorb your calcium. So you need the 1-2 punch. You need the vitamin D to help you with your calcium as well. So next we're going to move on to magnesium, which is like, I don't think you can do a 3-2-1 punch, or either way, you need all three. So I want you to have calcium, vitamin D, and magnesium. And there's lots of products out there that are calcium magnesium blends. They probably have vitamin D in there as well. Magnesium is also plentiful in the diet, but I do find that due to poor soil conditions, most of us need a little bit of extra magnesium every once in a while. And if we're worried about bone health, then we really want to make sure that we're just supplementing, just to make sure that we have that basis covered. Magnesium is also helpful for a few different things. It's been shown to help in cases of PMS, stress, constipation, you name it. Magnesium is also one of those kind of minerals that checks a lot of boxes in terms of what it can help with. So the next two that I'll talk about, maybe you haven't heard of, kind of vitamin K, except it has become more popular. People are coming in and talking to me about vitamin K. Vitamin K is also found in leafy greens, but it's really been known as a vitamin that helps with blood clotting. So that's how maybe you've heard of it. But it also helps with kind of absorption of calcium. And so it's not a bad idea to kind of supplement with. You can get a lot of vitamin D plus K2 products. Not the worst idea. I do find that I like to keep them separate so that I can kind of know what I'm doing with the dosage of the K versus the vitamin D, because I might be a lot higher with the vitamin D than the K. And then the last nutrient I want to mention is strontium. And strontium, again, maybe you haven't heard of it, but it is a mineral that's found in bones that really increases kind of density but strength, and there's research that says that it reduces your risk of fracture. And that's always what we're looking for, is the research to really show us that, oh, you get less fractures. So that's everything for today in terms of bone health. If you have any questions, just you can check out my website below, send me an email or give me a call. But again, my name's Dr. Sheila, and I'm a naturopathic doctor here in Toronto. And have a great day. Be well.